Hello, everyone. Today we're going to talk about something very important: what smoking does to the human body. This is not a lecture. This is not about blaming anyone. This is simply the truth explained in a clear and human way. Many people start smoking when they are young. Some do it because of stress, some because of friends, and some because they think it looks cool. At first, smoking may feel relaxing or enjoyable, but what many people don't realize is what smoking is slowly doing inside the body every single day. So let's break it down step by step, from the moment smoke enters your body to the long-term effects it can cause. 1. What happens when you smoke a cigarette? When you inhale cigarette smoke, more than 7,000 chemicals enter your body. Among them are nicotine, carbon monoxide, tar, formaldehyde, arsenic, ammonia. Many of these chemicals are toxic, and at least 70 of them are known to cause cancer. The smoke first enters your mouth and nose, then travels down to your lungs, and from there, harmful substances quickly enter your bloodstream. Within seconds, these chemicals reach your brain, heart, and other organs. So even one cigarette affects your whole body, not just your lungs. 2. Effects of smoking on the brain. Nicotine reaches the brain in about 10 seconds. At first, it creates a feeling of pleasure and relaxation. That's because nicotine releases dopamine, the feel-good chemical in the brain. This is why smoking can feel calming or enjoyable at the beginning. But here's the problem. Over time, the brain becomes dependent on nicotine. The brain starts to expect nicotine to feel normal. This leads to addiction, anxiety when not smoking, irritability, trouble concentrating, strong cravings. Eventually, smokers are not smoking to feel good, they are smoking just to avoid feeling bad. Smoking also increases the risk of stroke, memory problems, reduced focus, and learning ability. In simple words, smoking slowly rewires the brain in an unhealthy way. 3. What smoking does to the lungs. The lungs are the organs most directly affected by smoking. Healthy lungs are pink, soft, and full of tiny air sacs that help oxygen move into the blood. But smoking changes this. Tar from cigarettes coats the lungs like sticky black glue. Over time, this tar damages the tiny hairs called cilia, which normally clean dirt and mucus from the lungs. When cilia stop working properly, mucus builds up, bacteria stay trapped, infections become more common. This leads to constant coughing, chest tightness, shortness of breath, frequent lung infections. Long-term smoking can cause serious diseases such as chronic bronchitis, emphysema, chronic obstructive pulmonary disease, lung cancer. Many smokers don't notice severe lung damage until it becomes irreversible. 4. Effects on the heart and blood vessels. Smoking is extremely dangerous for the heart. Nicotine causes faster heart rate, higher blood pressure, narrowed blood vessels. Carbon monoxide from smoke reduces the amount of oxygen your blood can carry. This means your heart has to work harder just to keep you alive. Over time, smoking damages blood vessels and makes blood thicker and stickier. This increases the risk of heart attack, stroke, blocked arteries, poor circulation. Smokers are 2 to 4 times more likely to develop heart disease compared to non-smokers. Even young smokers can suffer heart problems, sometimes without warning. 5. Smoking and the digestive system. Smoking also affects the stomach and digestive system. It can cause acid reflux, stomach ulcers, poor digestion. Smoking weakens the muscles that control acid in the stomach, making heartburn and ulcers more common. It also increases the risk of mouth cancer, throat cancer, esophagus cancer, Stomach cancer. The chemicals in smoke damage the lining of the digestive tract, making it harder for the body to heal. 6. Effects on the skin, hair, and appearance. Smoking doesn't just damage organs, it also changes how you look. Smoking reduces blood flow to the skin, which means less oxygen and fewer nutrients reach skin cells. This leads to early wrinkles, dull, dry skin, uneven skin tone. Many smokers develop wrinkles around the mouth and eyes much earlier than non-smokers. This is often called smoker's face. Smoking also affects hair. Hair becomes thinner. Hair loss increases. Hair looks dry and unhealthy. Teeth and gums are also affected. Yellow teeth, bad breath, gum disease, tooth loss. So smoking speeds up the aging process, both inside and outside the body. 7. Smoking and the immune system. Your immune system protects you from infections and diseases. Smokers weaken this defense system. Smokers get sick more often, take longer to heal, have higher risk of infections. Wounds heal slower in smokers because less oxygen reaches damaged tissue. Smoking also makes it harder for the body to fight serious diseases, including cancer. 8. Effects on reproductive health. Smoking affects both men and women. In men, reduced sperm count, lower sperm quality, erectile dysfunction. In women, fertility problems, irregular periods, higher risk of miscarriage, complications during pregnancy. Smoking during pregnancy is especially dangerous. It increases the risk of premature birth, low birth weight, birth defects, sudden infant death syndrome. Smoking doesn't just affect one person, it can affect future generations. 9. Secondhand smoke, harm to others. Even if you don't smoke, being around smokers can still harm your body. Secondhand smoke contains many of the same toxic chemicals. Children and family members exposed to smoke have higher risk of asthma, lung infections, heart disease, sudden infant death. There is no safe level of secondhand smoke. What happens when you quit smoking? Now here's the good news. The body has an amazing ability to heal. When you stop smoking, after 20 minutes, heart rate begins to normalize. After 24 hours, carbon monoxide levels drop. After weeks, breathing improves. After months, lung function increases. After years, risk of heart disease and cancer decreases. It's never too late to quit. The earlier you stop, the more your body can recover. But even long-term smokers benefit greatly from quitting. Final thoughts. Smoking may feel like a small habit, but its effects are huge. It affects the brain, the lungs, the heart, the skin, the immune system, and the people around you. This video is not about fear, it's about awareness. If you smoke, know that quitting is one of the best decisions you can make for your body. If you don't smoke, protect yourself and encourage others to stay smoke-free. Your body works hard for you every day. Taking care of it is the greatest investment you can make. So if you learned something new from this video, click the like button, subscribe to the channel to watch more videos like this, and share with your friends. Stay healthy until we see new videos. Bye!